His talk is called "It Should Be Hard to Be a Drug User." It should be hard to be a drug abuser. And I'm not sure, I think it depends on how you say that, what the meaning of it is. Is it a question? It should be hard to be a drug user? Or is it a statement? It should be hard to be a drug user. We will find out. Over to you, Philippe.
Thank you. Yeah, I think it's important to see the quotation marks here, since it's not I that I'm saying that it should be hard. It's the police, actually. And this is going to be a presentation. It's difficult to come after Arne. I mean, I'm not going to put out a show like he did. So you're going to have statistics, all right, and a more traditional way of presenting them. And I also want to take the moment to say I'm really happy to be here in Oslo and to have the chance to present this report, and that also, that is in Swedish, and then the report also went is a paper in this journal. And I wrote it together with Henrik Tam and Albin Stenström. I know Albin is looking at this from Stockholm. Hey, Albin, since this is live streamed, as I have understood. Okay. The background for this presentation and for this study is that we have had several decades, 30, 40 years of a really punitive crime and drug policy in Sweden, as in the Nordic countries. We have never had an evaluation of it, and Arne talked about the importance of knowing if stuffs are working as we want. We have several government reports on the drug problem in Sweden, but the politicians have never asked the question if this harsh policy has worked as it's supposed to do. So ESO, this organization asked us to do such an evaluation. So the background is that drug use was criminalized in Sweden in 1998, and the aim was to reduce the number of consumers and drug-related risk and harms. In 1993, imprisonment was introduced in the penalty scale to improve the legislation's effectiveness. But this has, okay, how did it work has never been evaluated. And the expert group on public economics asked Henrik, Albin, and me if we could look at this, since the government haven't asked in the audit reports to do it. And that is what I'm going to present, the evaluation we did. But first, a short history of the Swedish drug policy. I'm pretty sure most of them, you know something about it. But, and I think also that all of us that are here today understand that drug use is associated with risk and that can lead to health problem and premature deaths. And I mean, it's a problem that we have to take seriously. The question is how we can take it seriously and reduce the cost in the most effective way. In the short history, if we go back in time in Sweden, drug use was an individual problem, often seen as something that should be taken care of the health sector. But during the 70s, it began to be seen as a social problem, and in the 1980s, more and more as a political problem. And in Sweden, we have this vision of a drug-free society. I think that you know about this also. And one of the proponents of the important persons in the Swedish history was a doctor called Nils Bejerot. And Bejerot's idea was that the most important part of this problem was the drug user. Since the drug user contaminates others, it's from the drug user that this disease as Niels Beirut saw it, spreads in the society. So what should a society do when you understand the problem in this way? You should go hard against the drug user. So this was embraced by the police, and the Swedish police board during the 1980s began to promote this and being a rather active actor in the political debate in Sweden, saying it should be hard to be a drug user. So that was the strategy, go against the drug user and not the upper in the pyramid. The politicians really loved this idea, and it began to be a political debate in Sweden. And from the right, they began to criticize the Social Democrats for not doing enough against this. So the Social Democrats felt that they have to do something. In 1988, we have the first reform. Criminalization of drug use was criminalized. So you're not you're going to get convicted if you use drugs. And the goal of this, and this is important since we are doing an evaluation of the aims, it was to reduce the number of drug users and the frequency of drug use, and also to reduce the risk of harms associated with drug use, including premature death. So we went back, and Henrik Tam have done this before, and looked how did the debate look like during the 80s, what was the political aims and goals, and we took them seriously. Okay, so this is what you want, have your aims being fulfilled. And 5 years later, since the police complained that this legislation was rather difficult to implement, since okay, if people now are committing the crime of using drugs, how do you prove it if you are a policeman? But if we can stop and search and force people to give blood and urine tests, then we can prove that they actually have drugs in their body, the crime that we have now in Sweden. So in 1993, the police got this tool, and wow, they have used it. So, from the mid-1990s, we see a sharp increase in the use of this new legislation in Sweden. And today, drug use is the most common crime among juveniles in Sweden. To be convicted for own use is the most common crime. So, our questions are simple. You wanted this. You implemented this because you wanted to do good. I'm like a little bit naive, so we took them seriously. We took the political aims seriously. You wanted a reduction of drug supply. You wanted a reduction in the number of drug users and the frequency of drug use. We wanted to see, or the politicians wanted to see, fewer negative consequences associated with the problematic drug use, such as health problems and drug-related mortality. And we also, and this was like our own, we wanted to also to ask this. We're going to take your goal seriously, but we're also going to look at the collateral damages. We're going to look at the control cost of this policy in our evaluation. Since policy always involves balancing expected benefits from other costs. And this is also said by the UN, and they describe control costs as the unintended consequences of a crime policy. So how have the costs associated with drug enforcement developed during the period covered by this policy? So this is what we are looking at. This is what I'm going to be presenting, the aims and the costs. Rather traditional setup for an evaluation of a policy. Shortly, I'm not going to bore you with methods, but we have to say something about it. This is like not an easy thing to evaluate, of course, We have several problems that we need to take seriously if we're going to do solid research and solid evaluation of this important policy. And one is, of course, that, okay, if you criminalize drug use, this is going to be more difficult to study, since we know from a lot of criminological research that crimes are difficult to study for several reasons. We have big dark figures. People don't want to tell you about crimes they have committed, and since this is a crime now, people are not going to easily tell you that they have experiences of being drug criminals in Sweden. So for most of our indicators, we have to suspect that we are describing fewer acts than they actually are, since this is a crime. The way to handle this is trying to triangulate, to use a lot of different indicators and data to gather around and to see a pattern of what's going on. So that is what we did, and that's what I'm going to present for you. Also, a second problem is, of course, we lack the counterfactual data. And this is like when you do a report for this kind of organization, they're always going to come up with this kind of questions since they are trained in economics. But what about the counterfactual? Yeah, we don't have a counterfactual since Sweden did this reform, and we cannot compare it with if Sweden haven't done it. We don't have municipalities that didn't do it, so we can compare with. So what we did was to compare with other Nordic countries and to see patterns if they were similar or different in Sweden who introduced this reform. Okay, now for the results. Here you have a graph, two different axes, one showing the price for cocaine, the other for cannabis and amphetamine at the street level in Sweden. And since this is like an illustration of the supply side, have the prices gone up? Have the supply of drugs in Sweden went down or up after this reform? They have come down. So we have cheaper drugs and more drugs in Sweden after this criminalization. So we can't see that it has been more difficult, more expensive to get drugs. What about the drug use in the population? Again, the reform was introduced in 1988, and 1993 we have the police tool, and we have data about self-reported drug use. So has it come down as the aim was? It hasn't. So actually, if you look at 1998 when this was introduced, we have the lowest level of self-reported drug use among juveniles in Sweden. After the criminalization, it went up, and it has been rather stable. So, and if we look at the older ones, those in 18 to 19 years old, we see a rather stable pattern among those juveniles. Again, this is self-reported data. We have the problem of not everybody telling of their experiences and so on. Next, what about the most serious consequences of drug use? Ill health and, of course, drug-related deaths in the population. Have they come down in Sweden? No, they haven't. We have different indicators, and you know this is rather tricky to measure and so on. But what we can see is that in all indicators, mortality is up in Sweden. For the last years, it's important that they have come down, and they have come down rather sharply, connected to harm reduction strategies as naloxone and so on, that you are well aware of. When we look at the Nordic comparison, we see that, and this is research done by Henrik Tam, and to put it shortly, since I know I'm a short time, the Swedish strategy is not the most successful, to say it putly gently. So, the drug-related deaths in Sweden aren't, we are not doing better than the other Nordic countries. So the conclusion for us is that the policy has not reached the goals. Criminalization has not been followed by a reduced and more expensive drug supply. We cannot see a lower level of drug use in the Swedish population. We have no indications of fewer problematic drug users or lower demands to the healthcare sector, and none of our indicators show fewer cases of drug-related mortality. Actually, if you look at the graphs, the most of our indicators show the opposite. And what about the collateral damages then? This has apparently been ineffective, and what about the cost? If we look at what the police resources to implement this strategy, they have gone up a lot. So the police are putting more and more resources to implement this punitive strategy. If we look at what crimes they are chasing, these are the recorded police cases of drug crime in Sweden over the period 1975 to today, and totally driven by, on the later part of the period, by possession or personal use. So that are the crimes they are chasing, not the more serious crime that were actually a great part of what the police did before this reform. But after the reform, they are chasing at drug users. Other control costs, of course, we have the legal principle of going the ultima ratio. We shouldn't criminalize if not necessary. This, we have actually done the opposite in Sweden. And a lot of people, a lot of acts are now criminalized that are, we know that there are millions of use occasions in Sweden, and they are criminalized. We have, of course, the problem of stigmatization, discrimination, and legitimacy. What do I mean with this? A lot of these tests that the police do, and to be tested is rather a difficult situation. You're going to be pulled out from the street, you're going to be forced to urine or blood test. I mean, that's a rather harsh reaction. And not all these are positive. A lot of them are negative tests, and they are increasing. And especially among the juveniles, half of these tests are negative. So they actually don't have a drug in the body. I said that this has become the most common juvenile crime in Sweden, the convictions of drug use. So we have a lot of juveniles now entering the young adulthood marked by a criminal record for drug use. That is the crime they have committed. And of course, we know from criminological research that to be marked by a criminal record has consequences, negative consequences. It makes it more difficult to, for example, enter the labor market. And Arne talked about the importance of the job for everything, to have a job. So this is a huge problem. And of course, we have the problem of discrimination and legitimacy, since we have causes to think that this police action is not equally distributed. Drug use is common among all juveniles and high school kids to use drugs. And most of users in Sweden will never get caught. So we have asked the question also, is this control policy biased against certain groups? and this is, of course, difficult to analyze, but we have done some studies. And how many minutes do I have? 5. Great. Then I have some extra time, and I think I'm going to show you some ongoing research where we are looking at this biased enforcement from the police against drug users. So, in a new study that we call Criminal Policy and Life Chances, a multi-cohort study of criminality and welfare outcomes among young people growing up under different drug policy regimes. A long title, but that sums up what we want to do in this study. So what we are looking at are the importance of being born in different periods when the drug policy was different. And we have data from different cohorts in Sweden. So what we wanted to do, or what we are working with, is here you can see different cohorts, people born in 1984, 85, and so on, and the time period. So some of these oldest cohort, they were born before the reform and some after. And we know that the drug use among juveniles have been rather stable, but the risk, of course, to ever be convicted for drug use have increased sharply in different cohorts. So independent of what you do, it is when you do it that is important. And now then we also ask the questions if we can do it in our data, who are getting caught. So here we're going to look at one indicator that you have, let's say, poor parents. These are the group that have parents that have less income than 50% of the population. So they have 50% of the national median, of course. So this is an indication of that you have low economical resources when you are young. This is how it looks in the general population in Sweden. So we can see a small increase in that, and it's connected to higher inequality in the Swedish society. So this is like in normal population. Now we're going to look how it looks among those that are convicted for drug use. And we expect it to be higher, but we're also going to see that we see a polarization. So more and more of them have this background. So our preliminary conclusion and what we have shown in other studies that this drug policy also target selectively against the usual suspect, individuals from more poor upbringing, often in another study from with immigrant background. So young men in vulnerable neighborhoods are getting targeted more than other groups by the police. So our conclusion then, to sum up, is that the criminalization of drug use appears to constitute an expensive, an ineffective, and harmful way of dealing with the drug problem in the Swedish society. However, the Swedish drug policy continues to move in the direction of increased repression. Sadly, of course. And we concluded our report, and when we report this, that the time has come to reevaluate and choose a new, more effective strategy, and that we proposed that drug use should be decriminalized again in Sweden as it was before. The policy answer was not thank you, and we will do it, sadly.
Thank you.